development of the new clinical services wing is part of our long-term strategic plan to remain modern, vibrant and innovative to ensure that we deliver the very best treatment to an evolving police service. Despite the challenges that 2020 has brought to us so far, we're delighted to announce that we've now formally started work on the much-needed wellbeing wing extension in Harrogate. And although we prefer to be open for patients at this moment, workings while closed has meant there's been no disruption or inconvenience through noise or other building works to patients and residents. The new clinical wing will add 20 new bedrooms, 4 counselling rooms, 1 nurse's office, 6 therapy rooms, 3 workshop spaces and a community room to our real estate. We hope that this will drive down treatment waiting times, allow us to run an additional wellbeing programme each week at our Harrogate Centre and give us the opportunity to further expand and improve the wellbeing provision that we offer. Unfortunately, we still do not know when we're going to be able to open the reset centres, but we can assure you that we're working hard behind the scenes, reviewing government and clinical guidance to ensure that when we do reopen, our patients will be able to swiftly return and then receive the very best level of service and optimum benefit from their stays. However, we don't want to just focus on what we can't do at the moment, so I want to spend a few moments telling you what we've been doing over the last few months to continue to support the police family. Since closing, we've offered many hours of personal physio advice via our hotline. We've worked with the developers of Thrive, the only NHS-approved mental health app, to customise it for the police treatment centres to support mental well-being for our patients and employees. This app has already been sent out to hundreds of patients and staff to help them to manage stress, improve their well-being and build resilience in order to tackle issues more effectively. We've also engaged with over 7,500 people across social media, sharing tips and advice from our expert teams and partners to look after your mental and physical well-being. We've continued to offer monthly cash prizes in the charity lottery. We've continued to pay weekly support allowances and ex gratia support to police families when the unimaginable happened through St George's Police Children's Trust, and we've also taken on some new beneficiaries to this charity. And finally, we've donated all of our unused PPE to local care homes and hospices. But there's still a significant cost to the work that we're doing through the maintenance of our buildings and the work that we're planning to do, especially when we're unable to recruit new donors to the PTC or St George's at the moment or do any fundraising. Therefore, we ask all of you to speak to your colleagues, both new and existing, and encourage them, if they've not already done so, to sign up to both the police treatment centres and St George's in order to benefit from both our charities when we reopen. In these difficult and uncertain times, we'd also like to thank all of you for your continued support and indeed for the work that you're all doing, serving the country and putting your lives on the line and demonstrating great professionalism, courage and commitment to the country. The Police Treatment Centres and St George's Trust will be here to support you and your colleagues when they need it most, so please do keep on supporting us.